Well, thanks, Karin, for the presentation before. You made my day with the shockwave therapy because my French-speaking friends in Switzerland know I love shockwave therapy. I'm looking forward to the discussion, the debate, what we can do next to tendon loading, and of course exercise is the key with tendinopathy. We all agree, but what can we do additionally? Shockwave, Tecar, percutaneous electrolysis, we will see in the debate. So it's a pleasure to introduce now Gianpaolo Boschetti as the first speaker. He's a physiotherapist and strength and conditioning coach. He's a university professor in Milano, Beijing and Guangzhou, and has a lot of experience in elite athletes, mainly in the field of volleyball and beach volleyball. Gianpaolo, the floor is yours.
It's a great honor for me to be here and to share with you my experience with a sport professional. And especially today, the subject that I want to discuss with you is about the use of Tecar therapy in acute and chronic. Just a second. Just a second that I'm moving another presentation, so I guess I have to close this. Oh, okay. Okay, just the wrong command. Sorry. Tecar is an acronym for Capacitive Resistive Energy Transfer, but the general principle of the therapy is the diathermy. The general principle has been known from the end of the 19th century, but the name of Tecar has been registered as a trademark in 1995 by Unibel. So it's not a really new therapy, but is not so spread out around the world. The original frequency that was used and the most studied, the frequency that you can find in the research is about 0.5 megahertz, but nowadays we are start using a wider range of frequency till 1 megahertz to open more to the aesthetic part. But here today we have to speak about sports, so not for sure about this point. The transfer energy takes place using one isolated electrode in the capacitive mode or a conductive electrode in the resistive mode. The point of these two modalities that I will explain better later depends on the target that we want to reach, the tissue that we want to reach. The point is that we want to obtain a magnetic field that has to be effective in the deep of the tissue. To simplify the point, with both the kind of methodology, with Tecar therapy, we can be effective near the dielectric, so near the area where the conductive of electricity is low, so where it's difficult to arrive with electricity. The other important point is that with these two options, we can decide if we want to arrive to some deep tissue like cartilage, tendon, bones that has typically a low percentage of water, or if we want to stay on the muscles and stay in the more superficial layers. The other really important point that normally in sport professional we have to face every day is when we have to face about injuries. Injuries are in the acute phase, and we have the problem to start the treatment as soon as possible after the injury. In fact, in sport application, we have the chance to use immediately after the therapy, after the injury. Why this is so important? Because in the season, normally the main problem that we have is that we cannot stop the players. The competition goes on, the championship goes on, and we don't have time to recover properly. But also, another problem that we have to face every time is the chronic part. Because once we don't recover properly during the season, then in the end of the season, we have to face about all the chronicization of the pathologies. And this is especially very common when we are working with aged professional athletes. The aged we are, the more we can face chronic pathologies. The target of the therapy is, of course, to reduce the pain, reduce inflammation, fasten the recovery process, and to act as fast as possible after the injury. Other really good advantage is that according to some kind of options that we have during using the therapy, we can decide if we want to work on the muscle, on the joint, or on the tendons. But it's not magician. I don't believe in magic. So we cannot consider to use only this kind of therapy. But we can use, and we often use, before the rehabilitation protocol. When we use before the rehabilitation protocol, we have the chance to reduce the pain. So the rehabilitation protocol, the rehabilitation program with exercises or with manual therapy can be more effective. We can improve the ROM, so we don't have to use more time during the exercise part, and we can facilitate the muscle activation. But after the rehabilitation program, we have to face the same situation. We need to reduce the pain, we need to reduce the inflammation, we need to fasten the recovery process, and sometimes to prepare the body for other manual therapies. Of course, the professional athlete they do just this for a job, so they have plenty of time. What we don't have is the time from one day to the other, because the competition is running. One thing that I consider very important is the combination with different methods. As I told you, we can use before and after the rehabilitation program. That's a crucial point, because often we need to combine different kind of methods. We can use manual, we can use rehabilitation exercises, or even electrostimulation, some situation. One step back. What we do in the acute phase? Acute phase, the RICE protocol is still the gold standard, but we can use also the diathermy, the Tecar therapy. The point is that we want to reach, again, the points are the same. Reduce the pain, reduce inflammation, and reduce the swelling. But we need to take care about one very important thing, that hyperthermic effect in the acute phase can create huge problems. The useful thing is that we can obtain a lot of benefits with the diathermy, but even without the hyperthermal effect. So the advantage of the therapy is that we can use before, we can use after rehabilitation program, we can use with hyperthermal effect or without thermal effect. In the chronic phase, the situation is different, because in the chronic phase, normally we expect that we don't have a huge inflammation process working, but we can use the thermal effect as support. This is very important for me to be clear. The thermal effect in Tecar therapy is one of the effects that we can obtain. It's not the only effect that we want to obtain. Otherwise, we have so many other hyperthermal therapies that can be useful. In the chronic phase, we can use the thermal effect to facilitate the manual treatment, to reduce the stiffness, to improve the vascularization, and to reduce the pain. While no thermal effect, that, as I told before, we can use in an acute phase, but also in the chronic phase, can be used to reduce the swelling, to reduce the edema, to reduce the pain, not with the same effectiveness of the thermal treatment, but is useful also for that, similar to the magnetotherapy. So that anyway we are speaking about high-frequency current, but the effective on the tissue is connected to the magnetic field generated by the electricity. We fasten the recovery process, and we speed the metabolic activity. The other really important point is that we have two different methods of working. We can use the resistive mode. So if I want to work on the bone, tendon, ligament, and cartilage, I have to choose one mode of working. When we choose this kind of modality, we need to use the handpiece and the plate that are both conductive. So the electricity will pass easily through the body and will reach the dielectrics, so the area with low electric conductivity, that are bones, tendon, and cartilage. And here I show how are the pieces. The round one is the handpiece, and the square one is the plate. Here I show two different examples of treatment with resistive mode. There is also the chance to use some other tool that can be more useful, for example, when we need to travel or when we have to treat some part of the body that are not so comfortable to be treated. This is just an idea of what we do, what happens during this kind of treatment. Here we was with in the Giro d'Italia. Here was doing the treatment outside with a single hand piece, the last part that I was showing. Working on the shoulder is often more comfortable to use with that device. The other option is the capacitive mode. The difference is on the handpiece. In this case, we use the plate that is conductive and the handpiece that is insulated. So the dielectric, in this case, is on the surface, is on the handpiece that we are using. And this image can be much more clear. You see, the effective of the therapy is just on the surface. So mainly we use for muscle treatment, also because the dielectric is on the surface, so we cannot reach really deep, the deep tissue. Now I want to show you a couple of examples how to do it. We have to choose the modality and we have to choose the intensity. So if I have to face a muscle problem in an acute phase, I use a capacitive mode and a thermal effect. A thermal effect because we are in an acute phase, capacitive mode because we want to work on layers with high water density. But on the other side, if I want to work on example, and I just follow the speech before, if I want to work on a tendon chronic problem, I change the modality. So I use the resistive mode because I want to arrive deeper in the tissue, and I want to use the thermal effect. In this case, I change the intensity and I change the modality. I wanted to bring you one article that I think that can be more focused on the target of today. That is developed on a huge amount of athletes from the CONI, Institute of Sport Medicine in Turin, that shows exactly what is the subject of my speech. Acute and chronic. We can see that the effect in the acute and the chronic treatment, in the acute and chronic pathology, the effect of the treatment are pretty similar. So the effect of the therapy is shown as valid in both situations, but also it's really important to see this because the articular, muscular, and tendinous treatment, the treatment on different kind of pathology are, again, pretty similar. Why is possible to have so good results in using the same device, the same therapy on different pathology, on different problems? Because we can choose the intensity, and we can choose the modality. In the end, what is the point that I want to bring you home? That Tecar therapy can be used in an acute phase, we can start using immediately after the injury. This happened to me many times in volleyball when we have ankle sprain. As soon as we have the diagnosis, we can start to do the therapy. And typically in professional sports, this happens within hours after the injury. We can use also in the chronic phase. We can use the hyperthermal effect as a choice. This is really important. Doesn't mean that you need to use the hyperthermal effect of the therapy all the time. Because imagine if I use hyperthermal effect on an ankle sprain within hours after the injury, everybody knows what happens. I need to change the shoes, I need to change the socks. And nobody will sleep that night. Can support the rehabilitation process. Also, this for me is very important because I don't believe that one single therapy can solve all our problems. Otherwise, we should not be here. We can use after the competition and after the training. This is another thing that we use really often. Athletes finish the competition, athletes finish the training before start to do some kind of rehabilitation program or before doing some kind of specific treatment. We use the Tecar therapy to reduce the pain because we know that in sports pretty often the players when finish the training or finish the competition have some pain and then start the recovery process. It's useful to reduce inflammation. It's useful to fasten the recovery process. Also this in sport professional is very important because we don't have time. Now, this week, for example, in Italy, the A1 teams, they play 3 times in 7 days. In 7 days, 3 times means no time for training, no time for recovery, no time for rehabilitation. And the last but not the least, changing the modality, changing the intensity, we can be effective on the muscle, on the joints, and on the tendon. Thank you, and if you have any further question, I'm there.
Thank you very much, Paolo. We'll see you again afterwards in the debate.